All right, guys, so when it comes to advice on your health, who do you trust? Do you go to a doctor or do you look it up yourself sometimes? Well, how do you answer that question may depend on your age. Dr. John LaPook has been looking at a troubling new trend. Dr. LaPook, good morning.
Good morning, Adriana. You know, when it comes to finding important answers on health, doctors are often competing with Google and social media. According to a recent survey, for people ages 18 to 34 years old, nearly half, 45%, think individual research is just as good as their doctor's advice. I'm that doctor, Adriana. That's twice as high as those 55 and older. So what's behind this trend? And I recently had the honor of moderating a panel at the Aspen Ideas Health Conference and met somebody who can help answer this question. His name is Steve Rathje, and he is an incoming assistant professor of human-computer interaction at Carnegie Mellon University. And maybe just as important, he has more than 1 million followers. 1 million followers on TikTok. That beats me by 999,000.
That's peer review for you.
And he's famous on TikTok for his science videos. Here's a taste of his style.
I'm a psychology researcher, and I've published articles, like this one, about what tends to go viral online. In this article, I found that dunking on people we dislike is a particularly good strategy for going viral on the internet, and other research has found that negative, extreme, or intense content is particularly likely to go viral. However, in another paper,
So welcome, Steve. And you know, we were at this Aspen Ideas conference where we met. I was super impressed. Courtney Gray Haupt, who's the global health chair at Edelman, provided all those amazing statistics I read, and I was blown away by how influenced people are, especially young people, by the internet, and that they're sort of believing them often more than they believe moi.
I know, it's a concerning trend, and I am both a scientist who studies social media and what goes viral on social media, and I am an influencer. I'm a content creator who, you know, tries to go viral on social media. And I think what's concerning about the social media environment is oftentimes it's not accurate information that goes viral, but instead it's outrage, it's sensationalistic content or conspiracy theories that go viral and attract our attention. And I think we really need to be aware of that.
So how do you make accurate information more sensational and therefore viral?
Well, you can see in this clip that I'm making a giant container of iced coffee while I'm talking about science. And the reason I did that is I saw all these videos on TikTok go viral where creators were making giant iced coffee. So I was like, what do I do to make science go viral? And what I know from the science of virality is sometimes outrage and negative content goes viral, but we can also lean into positive emotions like awe and surprise. And that's how I try to make science go viral. But it's really tough when you're in this incentive structure of social media and the algorithms don't always promote the most constructive content.
So is there anything you can do to help your algorithm treat you better in terms of the science information that it gives you?
Yeah, so I think we really need to treat our information diet like our health diet. Just like we are careful about what kind of nutrition and health that we put into our body, we need to be careful about the information we put into our body. We conducted a study, my colleagues and I, where we incentivize a bunch of Twitter users to unfollow polarizing accounts on Twitter for 1 month. And we found that doing this reduced polarization with effects lasting up to 6 months after the study was completed, and also made people feel better about their Twitter feeds and made them share more accurate news. So something that you can do, you can go home and you can curate your social media feed. You can unfollow or block the most toxic accounts, or you could reduce your social media usage altogether. You just need to be mindful about the information that you're consuming.
And there also has to be education. So Chris Livesay, about a year ago on Sunday Morning, did a piece about Finland.
This was our Rome correspondent?
Oh, our Rome correspondent, sorry. And in Finland, starting at age 6, they start teaching the kids how to recognize fake news.
Well, that's what I was going to say, is like sometimes you don't know that what you're consuming is fake. I get a lot of like parent content about things that are proven good or bad for parenting, and I'm like forwarding it to my husband, but like I have no idea if this is real or not. So how can people tell if something is legitimate or not?
Yeah, we really need media literacy because algorithms and social media companies are trying to create addicting products. They're trying to flood your feeds with outrage because their business model is to keep you hooked, basically. So you have to work against that. So one trick to recognize misinformation or conspiracy theories is really think about how the content makes you feel. Is it confirming your biases? Is it using emotional language? Is it using moral outrage or polarizing language? Because what we find in our research is that it's a small number of influencers. We often call them conflict entrepreneurs because they are making their living by selling outrage online. And you really have to be careful to spot these people and pay attention to the amount of emotional language that they're using. That's the first hint that someone might be a conflict entrepreneur.
Really great stuff, Dr. Lepouk. Stephen Rathje, maker of giant iced coffee. Thank you very much.
I got to start making iced coffee when I'm talking to my patients.
It was engaging. It was. I was watching.
Yeah, it's funny.
Yeah.
Like, that's
the trick.
It is interesting that that's engaging online, but if you did it in your office,
They'd
like,
say, what?
the complaint box would be stuffed with, he wasn't
Social media is
listening,
a
he was
different
making
world.
coffee.